Bismillahirrahmanirrahim. Quote for the day is: Surely in the remembrance of Allah do heart finds comfort. The topic for today's presentation is coronary heart diseases. I am Dr. Ayesha Amin and I will be presenting this under the kind supervision of Professor Dr. Saira Afzal. The learning outline for today's presentation is Introduction, Pathophysiology of Coronary Heart Diseases, Risk Factor, Clinical Presentation, Diagnosis and Management, Epidemiology, Prevention, WHO programs for coronary heart diseases, recent updates, and multiple choice questions. The learning objectives. At the end of this presentation, the participant will be able to describe coronary heart diseases, its epidemiology and risk factors, prevention and management strategies, and to be able to answer the MCQs. Introduction. Coronary artery diseases is a type of cardiovascular diseases. It happens when the heart's blood supply is blocked or interrupted by a buildup of fatty deposit called atheroma or plaque in the coronary arteries. This buildup, called atherosclerosis, can lead to conditions like angina, that is chest pain, or myocardial infarction, heart attack. Coming to the pathophysiology of coronary artery diseases, coronary arteries they become narrowed by the fatty material deposition within their walls. The fatty material, which is called atheroma, sometimes known as plaque, can build up inside the coronary arteries. Arteries may become so narrowed that they cannot get enough blood to the heart. If a piece of atheroma breaks off, a blood clot, that is the clump of blood, forms around this to try and repair the damage of the arterial wall. Clot can block coronary artery and cut off the supply of blood and oxygen to the heart muscle, leading to angina or acute coronary syndrome, that is ACS. This diagram is just showing the pathophysiology of coronary heart diseases. This is the normal arterial wall with the normal flow. When there is deposition of plaque, that is the fatty deposit, it leads to the abnormal flow into the coronary arteries, and the plaque sometime it break off and lead to the disrupt blood supply of the coronary heart diseases, coronary arteries, leading to the infarction of the muscle of the heart. This is the basic classification of the coronary artery diseases. The coronary artery diseases, they are divided into the stable ischemic heart diseases or the acute coronary syndrome. The stable ischemic heart disease are known as chronic angina, while the acute coronary syndrome, it is divided into ST elevation MIs, non-ST elevation MI, or unstable angina. So angina is basically defined as the chest pain or an uncomfortable feeling that happens when the blood flow to your heart muscle is reduced. It is the common symptom of coronary heart diseases. Different types of angina. There are four different types of angina that exist, and they are as follows. Number one is stable angina. The stable angina is the most common type of angina, and it usually take place when someone participate in exerting physical activities. The unstable angina, as the name suggests, is more unpredictable, can occur when the person is resting. This kind of pain can be more severe and could keep getting worse. The microvascular angina can occur during moments of physical exertion, in the middle of one's daily routine, or during the moment of a patient experiencing strong emotions. While the variant angina, which is also known as prinzmetal angina, is caused due to the spasm in the patient's arteries, which reduces blood flow. This kind of angina usually occur in cycles, mostly when the patient is resting or asleep, and can be treated using angina medications. The second category is myocardial infarction. The myocardial infarction, which is commonly known as heart attack, is caused by the decrease or complete cessation of blood flow to the portion of myocardium. The myocardial infarction, they may be silent or go undetected, or it can be catastrophic, even leading to the hemodynamic deterioration and sudden death. And it is a medical emergency which needs urgent treatment. There are two types of myocardial infarction, that is ST elevation myocardial infarction, usually caused by a complete or prolonged blockage of a major coronary artery, while the non-ST elevation MI can be caused by a partial or temporary blockage of a coronary artery. This is the ECG interpretation of this myocardial infarction. The image on the right side, left side, is showing the normal ECG rhythm with PQRST waves, while the image on the right side is showing the ST elevation MI. There is the elevation of ST segment on the ECG, while the non-ST elevation MI is shown by a dip in the ST segment. There is another term which is known as silent myocardial infarction. A silent myocardial infarction or silent heart attack is a heart attack with the minimal or non-recognizable symptoms. Instead of the classical signs of chest pain, the people may experience subtle symptoms like fatigue, nausea, or indigestion, which can lead to the delayed medical treatment. The silent myocardial infarction is most commonly seen in diabetic patient because of the issues of nephropathy or neuropathy. The common risk factors which are associated with coronary heart diseases, there are certain modifiable risk factor and certain non-modifiable risk factor. The modifiable risk factors are hypertension, dyslipidemia, diabetes, smoking, alcohol, stress, obesity, and physical inactivity. While non-modifiable risk factors are family history of coronary heart diseases, age, and ethnicity. There is a term which is known as Framingham risk scoring. That is basically a tool that is used to estimate an individual's 10-year risk of developing cardiovascular diseases. The score is calculated using age, sex, blood pressure, total cholesterol, HDL cholesterol, and smoking status. Diabetes is also a key factor in the calculation. Each of the factor is assigned a point value. The points are added together to produce a total score, which is then used to determine the percentage of a 10-year risk of cardiovascular diseases. There are three risk categories. The low risk category, in which the score is less than 10%, the moderate risk, in which the score is between 10 to 19%, and the high risk category, in which the person has a score of 20% or higher. The clinical features of the coronary heart diseases ranges from symptoms of discomfort or pain in chest, pain radiating to the shoulder, neck, jaw, or left arm commonly, nausea, vomiting, sweating, lightheadedness, shortness of breath, and heartburn, which is usually a atypical symptom. The diagnosis of coronary heart diseases are made on the basis of following tests, that is ECG, chest X-ray, echocardiography, coronary angiograms, blood tests which include troponins, LDH levels, and CKMB levels, and exercise stress tests. The management of coronary heart diseases lies on three pillars, that is lifestyle changes, medical therapy, and surgical therapy. The lifestyle changes, the patient are asked to stop smoking, exercise regularly, eat a healthy diet, that is a diet that is low in saturated fats, salts, and cholesterol, focus on fruits, vegetable, whole grains, and fish, manage weight, and reduce stress. The medical therapy, the statins forms the mainstay of treatment, which lowers the cholesterol level. Then there are antiplatelet, which helps decreasing blood clotting, which are known as blood thinners. Antihypertensive, which lowers blood pressure, and other medication may be prescribed to manage condition like high blood sugars or to help with the heart failure symptoms. The surgical treatment. The surgical treatment is mainly around angioplasty and coronary artery bypass grafting. In angioplasty, a stent is placed to open the narrowed artery, and in coronary artery bypass grafting, it is a procedure which is used to create a new path for the blood flow to bypass the blocked artery. The complications of coronary heart diseases are heart failure, atrial fibrillation, pericarditis, ventricular aneurysm, pulmonary edema, recurrent ischemia, and stroke. Coming to the epidemiology of the coronary heart diseases, according to the American Heart Association, globally, it was estimated that in 2021, there were 254.28 million people who were living with the ischemic heart diseases. It was more prevalent in males than in females. There were 145.31 males who were suffering from ischemic heart diseases. An estimated 8.99 million total deaths are due to the ischemic heart diseases that occurred globally in 2021. In 2021, North Africa and Middle East had the highest prevalence rate of ischemic heart diseases among regions, followed by Eastern Europe and South and Central Asia. Ischemic heart diseases mortality rates were highest for Central Asia, Eastern Europe, and North Africa and the Middle East, and mortality was lowest for high income Asia Pacific. The burden in Pakistan. In Pakistan, coronary heart diseases is a major public health concern, with the WHO reporting 240,720 deaths from coronary heart diseases in 2020, which accounts for 16.49% of all fatalities. The death rate from ischemic heart diseases in Pakistan in 2021 were about 174.3 deaths per 100,000 people. This is the chart from WHO, which is showing that the top cause of death in Pakistan in 2021 in both male and female were ischemic heart diseases. There were about 90 deaths per 100,000 in male and 89.6 deaths per 100,000 in male. Coming to the prevention strategies for coronary heart diseases, um, uh, the primordial prevention mainly focuses on promoting the healthy lifestyle, creating safe environments for physical activities, that is sidewalks and parks, healthy diets, that is discourage the use of salt, sugar, and trans fatty acid, implementing tobacco taxes, restricting advertising of harmful substances on social media platforms, improving access to healthy foods, and promoting journal health education in school. There is a term which is known as prudent diet. It is a diet that it is a broader diet plan that include the healthy diet. It includes plenty of fruits, vegetable, legumes, that is beans and lentils, nuts and whole grains, and it encourages to eat fish, lean cuts of meats and eggs, prioritize polyunsaturated fats over saturated fats, and consume unsaturated oil and spreads in small amounts. Total fat to be around 30% of your daily calories and less than 10% of calories from saturated fat. Maximum daily intake such as no more than 300 milligram. A high fiber diet, limit free sugar, that is added sugar and those naturally present in honey, syrup and juices, to less than 10% of total energy intake, and drink plenty of fluids, especially water. Coming to the primary prevention states that maintaining a healthy diet, that is the DASH diet or Mediterranean diet, engaging in regular physical activity, at least 150 minutes of moderate intensity exercise per week, quit smoking or never start smoking, maintaining a healthy weight, managing existing conditions like high blood pressure, high cholesterol, and diabetes, and aspirin in selected high risk population. DASH diet, which is the dietary approach to stop hypertension diet, is a flexible eating plan designed to prevent and manage high blood pressure by emphasizing food rich in potassium, calcium, magnesium, and fibers such as fruit, vegetables, whole grains, and low fat dairy. It is low in sodium, red meat, sweets, and sugary drinks, and it is recommended to lower the blood pressure and reduces the risk of heart diseases and stroke. The DASH diet states that there should be less than 6 servings per day of lean meat, poultry, and fish. There should be 6 to 8 servings of whole grain, 4 to 5 servings per day of vegetables, and 4 to 5 servings per day of fruits, and 2 to 3 servings per day of low fat or free fat diet. Secondary prevention. Secondary prevention lies on screening for the coronary artery diseases with ECG, stress test in asymptomatic patients, implementing aggressive lifestyle modification alongside appropriate medications, e.g., which include statins, blood pressure lowering medications, and antithrombic agent like aspirin, regular monitoring of blood pressure, cholesterol, and blood sugar levels, and revascularization procedures, which include angioplasty and CABG. These are the screening guidelines by American Heart Association. The recommended screening for blood pressure is each regular healthcare visit or at least once per year if blood pressure is less than 120 by 80 millimeters of mercury. Cholesterol, that is fasting lipoprotein profile to measure total HDL and LDL cholesterol and triglyceride every 4 to 6 years for normal risk adult, more often if you have elevated risk for heart disease and stroke. Weight body mass index during your regular healthcare visit. Waist circumference as needed to help evaluate cardiovascular risk if your BMI is greater than or equal to 25 kilogram per meter square. Blood glucose level at least every 3 years, and discuss smoking, physical activity, and diet at each regular healthcare visit. The American Diabetic Association recommends testing for pre-diabetes and risk for future diabetes of all people beginning at the age of 45 years. If tests are normal, it is reasonable to repeat testing at a minimum of 3-year interval. The tertiary prevention includes long-term rehabilitation for heart failure or post-MI, providing ongoing rehabilitation and psychosocial support to help patients adapt and resume daily routines. This is a WHO stepwise approach to the non-communicable disease risk factor control and surveillance. The WHO stepwise approach to NCD risk factor surveillance is a simple standardized method for collecting, analyzing, and disseminating data on key NCD risk factors in countries. The survey instrument covers key behavioral factors, that is tobacco use, alcohol use, physical inactivity, unhealthy diet, as well as key biological risk factors, that is overweight, obesity, raised blood pressure, raised blood glucose, and abnormal blood lipids. So this is the WHO stepwise approach for the risk factors. The step one includes the core demographic information, which is known as, and it is questionnaire based, and it includes age, sex, literacy, and highest level of education, whether the patient used tobacco history, alcohol consumption, fruits and vegetable consumption, and physical activity. The step two involves simple physical measurements, which includes the measurements of height, weight, waist circumference, and blood pressure, while the third step includes the biochemical measurements, which includes the determination of serum lipids of the participant. The WHO programmed the Global Action Plan for the Prevention and Control of the Non-Communicable Disease. It was initially started for the in 2013 to 2022, and it was now extended to 2030 by the World Health Organization. It aims to achieve a world which is free of the avoidable burden of non-communicable disease, as outlined in 2023 to 2030 implementation roadmap. These are the objective of the gap of 2023 to 2030, which aims to a relative 25% reduction in the risk of premature mortality from cardiovascular diseases, cancer, diabetes, or chronic respiratory disease. It aims to decrease the 10% reduction in the harmful use of alcohol, 10% relative reduction in the prevalence of insufficient physical activity, a 30% relative reduction in the mean population sodium intake, a 30% relative reduction in the prevalence of the current tobacco use, a 25% relative reduction in the prevalence of raised blood pressure, or contain the prevalence of the raised blood pressure, halt the rise in obesity and diabetes. It aims to at least 50% of the eligible people, they should receive the drug therapy and counseling, including the glycemic control to prevent heart attacks and stroke, and 80% availability of the affordable basic technologies and essential medical medicines, including the generics, and it required to treat the major non-communicable diseases in both public and private facilities. Coming to the recent update, the article states the prevalence and the risk factor of the coronary artery diseases in Pakistan. It is a multi-center cohort study. It was basically took place in the two major cardiology institute in Pakistan, that is the Benazir Bhutto Shaheed Hospital in Karachi and Peshawar Institute of Cardiology. The results stated that the overall prevalence of the coronary artery diseases was 34.9%, with a higher burden among urban residents, that is 37.2%, compared to the rural population, in which it was 28.5%. Men had a higher CAD prevalence, that is 36.7% than women, in which 32.4% of the prevalence was noted. And hypertension, diabetes, and obesity were independently associated with CAD, and nearly 47.3% of the patient presented late, with the delays more pronounced in rural areas. In conclusion, they highlighted there is a high prevalence of the CAD in Pakistan, with the significant regional and gender disparities. Hypertension, diabetes, smoking, and obesity remain key modifiable risk factors. Early screening program, public health intervention, and improved rural healthcare access are necessary to reduce CAD morbidity and mortality. So World Heart Day, it is basically celebrated on September 29 of every year to raise awareness about the coronary heart diseases and their prevention. Coming to the MCQs, uh, the first MCQ is a city launches a Walk for Heart Health campaign involving community leaders and social media influencers. This approach represents A, behavioral intervention, B, social mobilization, C, health protection, D, medical intervention, E, curative approach.
Alpha.
No, this is B, because we are involving community leaders and social media influencers. So this is basically known as social mobilization. MCQ number 2, as a country develops economically, rates of infectious diseases decrease while the non-communicable diseases, yeah, the risk of CAD increases. This pattern reflects a demographic transition, B, epidemiologic transition, C, social drift, D, risk transition, E, cohort effect. The right answer is B, epidemiologic transition. The third MCQ is, which screening test is most recommended for asymptomatic adults to detect early cardiovascular risk? A, electrocardiography, B, coronary CT angiography, serum LDL cholesterol, troponin I, and echocardiography.
A.
No, the most commonly performed tests are serum lipid profile, that is serum LDL cholesterol. For a public health team launches a workplace intervention for office employees to reduce sedentary behavior, poster awareness session, and group walking challenges are introduced. Which level of prevention does this intervention represent? A, primordial, B, secondary, C, quaternary, D, primary, E, tertiary.
D.
Yes, D is the right answer. To decrease the incidence of coronary diseases, stroke, and other non communicable disease, WHO has developed prudent diet guidelines which have been developed. Which of the following is not correct about prudent diet? A, dietary fat should be limited to 15 to 30% of the total daily intake. B, saturated fats should contribute less than 10% of the total energy intake. C, excessive consumption of the refined carbohydrate should be avoided. D, protein should be approximately 10 to 15% of the daily intake. E, salt intake should be reduced to less than 8 gram per day.
C.
No, E is the right answer. This salt intake, it should be reduced to at least less than 6 grams per day. So E is
Mhm.
the right answer. A hospital reports that the myocardial infarction patients arrive late because emergency medical services are poorly coordinated. A policy reform aims to improve the pre hospital response, reduce delays, and introduce chest pain triage protocols. This improvement primarily targets A, secondary prevention of coronary artery diseases, B, tertiary prevention, C, primordial prevention, D, health protection, E, high risk strategy.
B.
Yes, B is the right answer, tertiary prevention, because we are focusing on pre-hospital response to reduce the delays and to introduce chest pain triage protocols to prevent complications and disabilities. The MCQ 7 is a 58-year-old diabetic woman represent with the shortness of breath, mild epigastric discomfort, and fatigue. She denies chest pain. What is the most likely diagnosis? A, acid peptic disease, B, atypical MI, C, asthma, G, gallbladder colic, E, anxiety attack.
B.
Yes, B is the right answer. This is the presentation of atypical MI, which is most commonly seen in diabetic patient, in which normally the chest pain is absent. 8. A health department wants to warn people about the coronary artery disease risk due to smoking. Which method is most effective for public communication? A, complex statistical data. B, physician-only counseling. C, mass media campaigns. D, genetic testing programs. E, hospital-based workshops.
C.
Yes, C is the right answer because mass media campaigns will address a larger population. 9. A provincial health department wants continuous monitoring of major CAD risk factors such as smoking, diet, physical inactivity, and obesity. Which system is most suitable? A, sentinel surveillance, B, WHO step survey, C, event-based surveillance, C, case-based surveillance, E, passive hospital notifications.
B.
Yes, B is the right answer. The last MCQ is, a village with high CAD mortality launches a healthy heart community program that provides BP checks, smoking suggestion support, cooking demonstrations, and exercise group. Which type of prevention does this package mainly represent? A, primordial, B, screening only, C, secondary, D, tertiary, E, primary.
A.
No, the right answer is E, primary. This is the key to MCQs. These are the references. This is the official channel of the Institute of Public Health Lahore, where this presentation will be uploaded. Thank you.